What antibiotics are typically prescribed for wound infections?
Hello viewers! Today, we're going to dive into the world of antibiotics, more specifically, those used to treat wound infections. It's important to note that antibiotics should only be used under the supervision of a healthcare provider. Now, let's get started.
What is a wound infection?
Wound infections are caused by bacteria entering a break in the skin. This can happen after surgery, an injury, or a skin condition like an ulcer. Symptoms can include redness, swelling, pain, and pus. It's crucial to get medical attention if you suspect you have a wound infection.
Why do we use antibiotics for wound infections?
Antibiotics are drugs that kill or inhibit the growth of bacteria, making them essential for treating wound infections. They can help prevent the infection from spreading and facilitate the healing process. However, inappropriate use of antibiotics can lead to antibiotic resistance, a serious global health issue.
What are the common antibiotics for wound infections?
1. Cephalexin, Keflex, a first-generation cephalosporin that's often used for skin and soft tissue infections. 2. Amoxicillin-clavulanate, Augmentin, a combination antibiotic used when broader coverage is needed, particularly against bacteria that produce an enzyme called beta-lactamase. 3. Doxycycline, Vibromycin, a tetracycline antibiotic, often used for infected wounds due to its coverage of a broad range of bacteria. 4. Trimethoprim-sulfamethoxazole, Bactrim, used for its excellent coverage against community-acquired MRSA, a type of bacteria that's resistant to many antibiotics. 5. Clindamycin, Clindamycin, often used when there's a need to cover MRSA or when the patient is allergic to penicillin. Please note that the choice of antibiotic will depend on the type of bacteria causing the infection, the severity of the infection, and the patient's medical history.
Can wound infections be prevented?
Yes, there are measures you can take to reduce the risk of wound infections, such as keeping the wound clean, taking prescribed antibiotics correctly, and monitoring the wound for signs of infection. Remember, prevention is better than cure. Well, that concludes our discussion on antibiotics typically prescribed for wound infections. Always consult with a healthcare provider before starting any antibiotic treatment. It's been a pleasure sharing this information with you. We hope you found this video helpful. Stay healthy, everyone.